Hello to everyone. So in today's session, we will gonna discuss some OBG NCLEX question which has been repeatedly asked, and you should know also these concepts and all. So let's start the session. Okay. So first question which you can see on the screen dear is about the nurse observe a laboring client amniotic fluid and decide that it is expected color. So just we need to know what is the exact color which you will gonna see in a patient. एक amniotic fluid का normal color क्या होता है? Can you guess? The answer for this is straw colored, clear, and contains little white speaks. Okay. So let's have a further discussion regarding the various colors which you can see in amniotic fluid and what is the exact cause behind that. तो बेटा क्या होता है कि अगर बात की जाए amniotic fluid की तो जो ग्रीन कलर होता है वो आपको बताता है fetal distress, म्यूकोनियम स्टेन. Okay, म्यूकोनियम stain. Okay, म्यूकोनियम stain. If we talk about golden color, ये है RH incompatibility. Okay, and if you talk about the saffron color, it is post maturity. Post maturity. Okay. And if the amniotic fluid is very much dark in color or brown in color, it reflects iodine intrauterine death. Okay. So these are the various color, and repeatedly this yellow color or you can say golden color has been asked in exam, that is RH incompatibility. Okay. So RH incompatibility. Okay. Let's move further to the next question. The next question, dear. A primary gravida is admitted to the birthing unit in early labor. A pelvic examination reveals that her cervix is 100% effaced and 3 centimeter dilated. The fetal head is at 1 plus 1 station. In what area of the client's pelvis is the fetal occiput? See. What do you think will be the answer for this question? The answer for this question is below the ischial spine. So one thing which I want to tell you that dear, effacement is nothing but it's a thinning of cervix. Cervix कितना thin है वो होता है effacement. Okay, and the effacement is presented with percentages. Okay, so it will be 50%, 25%, or 100%. So 100% effacement means the cervix is very much thin like a paper, and it is a good thing. Okay, so in this image, what you will think the answer will be? क्या लगता है आपको आंसर क्या होगा? Below the ischial spine. So let's have a further discussion. So ischial spine in this image is thought to be the landmark from where you will gonna identify the position. So at the level of ischial spine, it is 0, and as soon as you will go upside, it will be in minus. Or ischial spine, so downward, it is in +1, +2 station and all. So when the doctors do a PV, so we will identify the ischial spine, and that station is taken as 0. Okay, and above that as in -1, and below that is +1 and +2 there. Let's go further. Now, the cervix of the client in the labor is fully dilated and effaced. The head of the fetus is at 2 plus. What should a nurse encourage the client to do? So what do you think? The fetus is at 2 station. क्या लगता है आपको? So she needs to like pan to prevent the cervical edema. This is the answer. Okay. Next question. Let's see the next question. A client is admitted to the birthing unit. Okay. And is planned for the amniotomy. So one of the important thing what I want to tell you about the amniotomy, dear, it is a kind of procedure, and it is known as the induction of labor. Induction of labor. Okay. Induction of labor. So there are two things. One is augmentation, where you want to accelerate. Augmentation एक word होता है, okay? और एक होता है आपका induction. So induction means when you are giving some medications and all to initiate the contraction, that is known as induction. And augmentation is the contractions are there, but now you want to accelerate कर रहे हैं speed contraction, so that is known as augmentation. Okay, so now what do you think the answer will be? क्या लगता है आपको? The answer for this will be both progressive dilatation and effacement. Okay, the next question. A client at 38 weeks of gestation is admitted for induction of labor. Her membranes are ruptured 12 hours ago. There are no other signs of labor. Which medication does the nurse anticipate will be prescribed? आपको क्या लगता है इसमें से क्या medicines देंगे? So the answer for this will be oxytocin. The answer for this will be oxytocin. Next question. Okay, let's move. Okay, the next question is, a client arrives at the hospital at 38 weeks of gestation with profuse vaginal delivery, okay, and state that occurs suddenly without any contraction. So she started having a bleeding without any kind of contraction or pain. So the answer for this is placenta previa. Okay, so always remember, that placenta previa is kind of painless vaginal bleeding. Okay, it is painless. So whenever a woman with placenta previa will wake up and see the whole bed will be wet and she will be in the pool of blood. Okay, so the answer is placenta previa. It is painless. And always remember, in placenta previa, no pervaginal examination should be there. Okay, next question. Next question. A pregnant woman who is in the third stage trimester arrives in the emergency department with a vaginal bleeding. She states that she snorted cocaine and approximately 2 hours. Which complication does the nurse suspect is the cause of the bleeding? So she has taken a cocaine 2 hours before, and what do you expect the client can have? The answer is abruptio placenta. Suddenly the placenta will get like premature suppression will be there. Okay. Next question. A client with a twins is told by the healthcare provider that she is at a risk of postpartum. Okay. So always remember, if you talk about the PPH and all, so when you will say PPH, when the blood loss is more than 500 ml. Okay, it is more than 500 ml. But the same thing, if we talk about the LSCS, if it is more than 1000 ml, then we will call it as a PPH. Okay. So later the client asks the nurse why she is at risk of hemorrhage. What should a nurse consider is the cause of the postpartum? आपको क्या लगता है PPH में इसमें क्या chance हो सकता है? Okay, the answer for this is uterine atony. The cause will be uterine atony. So always remember, atony is a severe cause. Now I will want to explain you how this uterine atony causes PPH. See, so this is the uterus and we are having blood vessels. The blood vessels are going on. So if the uterus is relaxed, these blood vessels are open and blood escapes from here. Okay, so this is known as a living ligatures because the muscle fiber is in the crisscross manner. Okay, and these living ligatures are getting when the uterus get contact, it get contacts and the bleeding is stopped. Okay, so uterine atony causes a great chance of having PPH. That's why immediate after delivery and all, after giving medications, which is in active management of third stage, we want to contract the uterus. So we used to massage that area. Okay. Next question. A client in labor at 39 weeks of gestation is told by the healthcare provider that she'll need a cesarean section, that she needs a LSCS. The nurse reviews the client's prenatal history. What pre-existing conditions is most likely reason for the cesarean section? So what do you think among the option will be the cause of LSCS? What can be the cause? What do you think? The cause for this will be your active genital herpes. See, torch infection whenever the mother is having toxoplasmosis, rubella, and cytomegalo and herpes virus infection is there. So we do prefer for LSCS. We do not go for normal vaginal delivery and all. Okay. So the answer for this is active herpes genital infection. Okay. Next question. This is the last question for this series. A nurse is assessing a newborn's respiration. What clinical findings indicates that their respiration are the expected rate? So what do you think the newborn respiration will look like among this? क्या लगता है आपका आंसर क्या होगा? The answer for this will be your irregular abdominal respiration, which lasts from 30 to 60 seconds. So I will tell you, if this is a newborn and all, and when you will gonna see a newborn usually have a respiration which is abdominal respiration. Okay. And if this is lungs, so thoracic respirations are not there in the newborn. Okay. So the abdominal will rise when you will see the newborn, and it is not in equal interval. It is irregular in nature. And normal respiration of the newborn is around 30 to 60. So again, one more thing I want to add on that. If this is the fetus abdomen and if this is the lung, so if a baby is having any kind of RDS, respiratory distress syndrome, so there is a presence of retractions are there. Retractions are there. Okay, what is retractions? You will see some kind of like deep inside this area, thorax area, retractions. Okay, so the answer for this is dear. The answer for this is fourth. The client will gonna see an irregular abdominal breathing, which will be around 30 to 60, which will be around 30 to 60. Okay. So I hope so. You have got some knowledge of small scenario based questions in OBG. Okay. So thank you so much.